Hello, I'm Dr. Garrett-Dijan Fairclough and I'm from HYC Medical. And as you know, October is Breast Cancer Awareness Month, but we tend to focus on the females, right? So now we're going to talk about the men. Men can get breast cancer as well. Cancer is a malignant tissue, and what that simply means is that it's tissue that has become abnormal and is overgrown in certain areas. Breast cancer is the #1 cancer in females in the world and is also the most common, most prevalent cancer in Jamaica in females. So there are many risk factors. Some of them are modifiable, meaning you can change your lifestyle to prevent your risk, and some of them are non-modifiable. So the non-modifiable risk factors are certain things like female gender, as we know men can get breast cancer as well. Age, so as you reach 40 and over, you are more likely to get breast cancer. You have certain genes or gene mutations that exist that make you at risk for developing breast cancer. The common ones we hear about are the BRCA1, BRCA2 genes. These genes can be tested through labs here, and the samples are sent abroad and you can get the results. Black and Latino persons are also at increased risk. OCP use, so that means contraceptive use with hormonal replacement, hormonal use. You have modifiable risk factors as well, and these include tobacco use, alcohol use, overweight and obesity, as well as inactivity. But that doesn't mean that if you're active, you can't get breast cancer.
Why should men take breast cancer seriously?
So men are way less likely to get breast cancer. Women are about 100 times more likely. However, it does exist. So 1 in 100 breast cancer cases were found in men. So 1 person in that 100 would be a male. Therefore, we should all be screening. So if you're a male and you have a family history, you're black, you should ideally be screened at age 40 for same. We're going to show you how to examine your breast as a male, right? So the first thing you want to do is to remove your shirt so you have a full visualization of both breasts. Now men have less breast tissue, therefore it's a bit easier than doing a female examination. So you can do it in the mirror, in the shower, and also lying down. What you want to do first is really look, right? You need to know how your breast feels and how it looks. So in looking into the mirror, you want to examine your breast in a neutral position, meaning your hands to your side, and then you want to examine the breast when it's flexed or when it's contracted, so your hands up, right, or your hands behind your head. You also want to examine the breast while pressing your hands into your hips as well. And all those positions help to kind of visualize different lumps or masses. So when looking, you're looking for any changes in the skin, any obvious lump, any obvious asymmetry, where one breast looks bigger than the other breast. So after you've looked, now it's time to examine. You want to use your left hand to examine your right breast and your right hand to examine your left breast. And you're using the middle 3 fingers and using the tips of the finger. All right, so let's use your left hand to examine your right breast. And it's the middle 3, great. And now there are different techniques, right? So the technique I'm going to teach is called the spoke technique. What that means, you're imagining the breast as a clock. So you'd have 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock, right? Always remember, up into the armpit or the axilla is a part of the breast tissue. So you want to not to forget that as well. So the easiest thing to do is to start from there. So you can start from under the breast, under the armpit, lift the hand a little, and you're going all the way under, and you're feeling for any kind of swelling or lymph nodes. All right, let's do 12 o'clock now. So you're going up, all right, going down to 6, all the way down to where the breast tissue stops, and you're going to 3 o'clock, and then you're going in between those areas. So from here out, so from here outwards, right, and then down diagonally. Then the other thing that we haven't done is here. Okay, all right, and then that would complete that part of the examination. The next thing you need to do is also to squeeze the nipple, right? You can get a discharge from breast cancer. So what you do is to use 2 fingers and just to squeeze the area to make sure there's no discharge from the nipple. And that completes the examination. So this can be done in the shower while lying down, or it can be done looking into the mirror. Now that was examining in neutral position. What you want to also do is examine the breast while the chest walls are contracted. So you can put the hand behind your head, right? Or you can put the hand to your hip and you're pressing in and you're doing the same technique over, right? And then that completes the examination. If it is that you feel a lump or feel a mass or have a discharge or there's something that is concerning, you would go and visit your doctor. And then another examination will be done and a mammogram may be necessary in that case. So with risk factors, it's over time. So it's over use over a certain period. So say for instance, you're using alcohol regularly, daily, weekly for over a year, that would be a risk factor. However, a one-time use does not increase your risk. So as a woman, you should start at age 40 in terms of screening for breast cancer. And breast cancer screening includes 3 things: the self-examination at home of both breasts, examination by a doctor, and also doing a mammogram or ultrasound as per your doctor's request. And this should be done every year. As you know, October is Breast Cancer Awareness Month, and we encourage every month that you examine your breasts at least once for that month. You can do it in the beginning of the month or the end of the month at home. It can be done in the shower, it can be done looking into a mirror, or it can be done while lying down. So what we're going to do first is remove whatever clothing you have on. For women, what you tend to want to do is to do a breast examination 7 to 10 days after your period, because during your period your breasts tend to be tender, tend to be swollen, and that may not give you the best idea of what's happening with the breast. But the aim of the self-breast examination is to know how your breast feels and how it looks. Different women have different breasts, have different breast tissue, so you need to know what is normal for you to then pick up what is abnormal. And in that, recommend that when you're 40 and over, you do a mammogram every year. So this examination does not indicate that you should not do a mammogram, you should still do a mammogram every year. Alright, so what you want to do first is to examine the breast in the neutral position. What that means is your hands to your side, no kind of contraction, no kind of flexing, just looking at the normal lie of the breast. What that allows you to do is to see if there's any changes in the tissue, any obvious swellings, any discharge from the nipple, any puckering of the nipple, right? Then you want to examine the breast while you're flexed. So what you're trying to do is contract the chest wall. So you're pushing your hands into your side, all right? So just push your hands into your side for me. And that contracts the breast and brings the tissue a little bit higher, and that helps to emphasize any swelling that may be there or puckering the nipple or skin changes. The other thing you want to do is suspend the breast tissue. So you want to put the hand over your head. So you put both hands up, all the way up, or both hands behind your head. All right, so those are the 3 positions basically that you need to do to see the tissue in different lies: relaxed, contracted, and the tissue lifted up. So you're in the shower, you can use some soap or just some water to kind of lubricate the breast. That is easier to examine, and you're using the opposite hand to examine the other breast, meaning that you're using your left hand to examine your right breast or your right hand to examine your left breast. You're using 3 fingers, so the 3 middle fingers, and you're using the tip of the fingers. Now, one thing that we tend to forget is that going into the armpit or the axilla, the tissues of the breast extend up into that area. So you have to examine the axilla, and that's where you will feel any kind of lymph nodes or swellings that may indicate something is wrong with the breast on that side. So a good way or a good place to start is there. So there are different techniques. The technique I'll be showing you today is called the line technique, right? So you're going in a line across, in a line across, in a line across from top of the breast all the way to the bottom. And you're continuing that same technique all the way until you reach under the breast. And this shouldn't take you more than 20 seconds, 30 seconds the most. And remember not to skip anywhere. So you're going in order, in a line. Okay, good, and go across again. So you're feeling for any kind of lumps, any kind of discomfort, anything that just feels abnormal for you. And that's why you need to do it every month. Now, when you're finished doing that line technique and you've examined all the breasts, the final step is to make sure there's no discharge from the nipple. Discharge can be a sign of an infection, and it can be a sign of breast cancer as well. So you're using the two index finger and the middle finger to squeeze the nipple. And you're looking for any kind of discharge. Remember, as I said before, during your period, you may have a discharge, you may have tenderness. That may be normal. But just to know that not every lump that you feel is breast cancer, but you have to go to your doctor to find out what it is and to get further examination and testing. In terms of bra wearing, that has not been proven to be linked to breast cancer. However, over time, trauma to the breast can cause masses to develop, and this very low risk can become cancerous in the future. When you have been diagnosed with breast cancer, what you first need to do is be staged. And what we mean by being staged is that you need to know where the breast cancer is. If it has spread to any other location, then that will direct your treatment. If it is localized, the thought is that you need to remove the breast to therefore get the cancer out of the body. If that spread to other locations, your treatment options may be a little bit different. So it may include removal of the breast plus some chemotherapy, radiation, depending on where it is and what it is. So breast cancer is one of the cancers that has been publicized, and the reason being is because it's the #1 cancer in females in the world. And with October being Breast Cancer Month, we hear a lot about breast cancer screening. But what we need to do is encourage women to do their examinations at home monthly so that they have an idea of how the breast feels and how the breast looks. So I do think there is a lot of policies out there that are encouraging that, but women need to know that it's not only in October, it's every month. So with any kind of cancer, of course, there's a lot of psychological trauma that exists, as well as a toll on the body. And having family members, friends who are aware and who are supportive is important, but also having outreach services, also having centers where women or men can go to get treatment, get counseling is also important. There are many that exist locally and abroad, and they have been fairly accessible to everybody. So my message to Jamaicans as it relates to breast cancer, as it relates to any kind of cancer, the aim is to do screening for early detection so that we can treat and eventually cure same.